here at Brookdale Health. We are the experts in auto injury, and we are sitting here with a physical therapist expert, and this is Dr. Crowley. How you doing?
Good, how are you?
I'm good. We was talking about roller coasters. You said what?
I love them.
So you love the roller coasters. And I just, the question was, with all of the jerking and moving and everything, could that cause injuries? Could people have a relapse or something? And we was like, we're not too sure.
Mm-hmm. Yeah, I've never seen a patient who's come in with injuries from a roller coaster. No one's actually come and seen me for that. But I could definitely see it if you already have an injury to your neck, and then you go on one and it might be more jerky, or go really fast or something like that. You could certainly have maybe a flare-up of your neck pain or something like that. But I'm sure those roller coasters go through a lot of testing and all of that. So it's really up to you if you want to try it or not. I know when I've gotten off of roller coasters, even though I love them, I know sometimes the certain ones that are more jerky than other ones, I can kind of feel it a little bit more in my neck, especially if you're not ready for that jerky movement.
And speaking of jerky movement, this is one thing that Caddy, the Prince of Darkness, he was talking about whiplash. What exactly is that?
Well, whiplash is an injury usually to your neck muscles, to the cervical spine region. So that's the ones between your head and right before your chest area. So this can happen when you have an impact that you're not ready for. You kind of go forward, go backwards, and then there's the tissue damage as well as potentially some slight damage to your cervical spine depending how bad it is. It can cause some inflammation going on there, severe neck pain, all of that, and it'd be great if you do have that to come in and see us.
So as a physical therapist, what exactly is a physical therapist and what do you do?
So as a physical therapist, I have 7 years of schooling underneath my belt. You have to go to undergrad first and then get a degree from that, and then you go on to physical therapy school. And then when you graduate from that, right now it's a doctorate program. So I have my doctorate in physical therapy, and then I have to pass the board exam, and then that qualifies me as a physical therapist to go out and actually practice in the clinic. And then as a physical therapist, we're kind of the experts in the musculoskeletal system. So we're the experts on the muscles, on movement, on rehab, how to get you better after an injury.
So after an injury and I need a physical therapist and I come in and I see Dr. Crowley, what is one thing that I would go through? How would you assess what I need done?
Well, it depends on what's going on. So if you have some low back pain, we'll come in, we'll have a conversation, we'll just sit down for a little bit. You'll tell me what's going on, I'll listen to what's going on with you, what's been bothering you lately, and then I'll have you stand up, I'll move you through some range of motion, but we'll just push it as far as you feel comfortable going. So if you have pain going all the way down through the ground, I won't make you do that. I'll just see what you can do at the moment. And then I'll go from there and I'll test your strength, and I will look at your muscles and where it's painful, and then I'll do some other special tests to give you more of a clear idea of what's going on with your body. And then from there, we'll talk and we'll figure out a plan going forward. How many times you're going to come into the clinic, what we're actually going to do when you come in here.
Now, when you talk about doing the different tests, a lot of people, they be like, no pain, no gain. What do you think about that?
I don't really like that motto because no pain, no gain. Well, people say there's a good type of pain and a bad type of pain, okay? If you have that bad type of pain, you're definitely not going to get better. The good type of pain, when the muscles are working and you're really working the muscles without any injury, then that's okay. But when you're injured and you're having pain with movement, that's not okay. We try to do things as pain-free as possible here because when you're already in pain, we don't want to make that pain worse.
All right, and the last question I have for you is, being a physical therapist, sometimes people want to lift more than what you believe they can lift and what they should lift with the injury that they have. What is your thoughts on that?
Well, it's individual to each person, depending on what their injury is. If you have pain when lifting with something, stop doing that, decrease the weight. When you come in here, we'll take a look at how you're doing. We can teach you how to lift correctly. And then oftentimes people are always lifting too much weight. You'll go to the gym and you'll see guys trying to lift, hundreds of pounds, but their form is horrible. So you want to make sure you always maintain good form when you're doing any sort of lifting. That way you have protect your back, your joints, and other areas so you don't have an injury.
Now, I was going to leave it at that, but you gave me the thought. And as a physical therapist, and you're in the gym, and you see these guys trying to lift something, what are your thoughts?
My thoughts in my head, well, many things go through my head, but oftentimes I don't know, I'm outside of work usually, so I just watch and I'm like, I hope they don't injure their back. I hope they don't hurt themselves. And I just sit there and I look at them. And then oftentimes I'll go and lift something. And then I have people coming over to me trying to tell me how to lift. And I'm like, hold on, sir. Like, I got this.
Well, that's a good time to have your cards
Yeah.
and tell them to come over here to book. All right, as you see, Q, we are sitting there having a lot of fun, and hopefully you're not one of them people, Q, that is lifting too much than you should. And I want to say thank you.
Yes, thank you so much. It was good.
All right, we're sitting here at 5740 at Brooklyn Boulevard in Brooklyn Center on the corner of Bass Lake Road and Brooklyn Boulevard. And you can contact us at 763-561-4045. Again, that number is 763-561-4045. Back to you, Walter Q. Bear Banks Jr. in the KMOJ studios.